Welcome to Hidden Diagnosis Impact. The podcast uncover the often overlooked and misunderstood conditions. From EDS, CCI, and beyond, we share stories and insights from those living with these conditions and healthcare professionals dedicated to diagnosis, treatment, and research. Join us as we uncover the reality behind these hidden diagnoses. Here is a podcast title update. Previously named Occult Awareness is now Hidden Diagnosis Impact, to better reflect our mission of revealing and understanding overlooked medical conditions. Welcome today's guest, Christina, and she is going to share her personal battle with many of EDS and the comorbidities and the road that finding the clarity amidst the uncertainty. So welcome, Christina. Thank you so much for agreeing to do this.
Well, thank you for having me. I'm Christina. So I have EDS, and I also have many of the comorbidities that come along with it. It's been a long journey, but I'm just really glad to be here and sharing my story with you today.
Awesome. And I just want to everyone to kind of understand a little bit first about where your journey started. First we always say EDS is genetic, and then so the first time that you encounter the symptoms.
Yeah. Well, the Ehlers-Danlos definitely comes from my dad's side. Now looking back, hindsight's always 2020. We can see a lot of his cousins and a lot of people in the family have it and have since been diagnosed. But I was the first, and I'd say probably one of the more severe. So I actually was pretty healthy until I was around like 9 or 10 years old. And it was more 10 or 11 that I started to really, it really got in the way. I was a competitive gymnast up until then, actually. And so it was kind of a little bit difficult to spot the hypermobility just because I was so flexible. So nothing seemed weird, and it didn't seem weird that I was having some joint pain here and there. It wasn't until I was about 11 that I started to have like GI issues. I got this stomach bug, and it was funny because the whole family got it, and I just could not get better. And it was like, after that, I would just catch like virus after virus and getting all these infections and new allergies. Like I just, would only be able to eat a few different foods, have a lot of vomiting. Of course, I was starting to have joint and back pain, and ultimately had to stop gymnastics, which was hard. And so at probably age 11 or 12 is when I really started to look for a diagnosis.
Yeah.
And I saw doctors across the board. And, you go to like a specialist for one small vague thing, and they do all the testing and everything's fine. And congratulations, you're okay. It's not really a congratulations when you still feel so terrible.
Yeah.
And so I kind of just went through life like that for many years. And it wasn't until I was 16 that an ear, nose, throat doctor just kind of happened to catch on my testing that I had like a pretty severe weakness in my vestibular system. So I was having terrible vertigo.
Yeah.
And dizziness, and just like I could barely like raise my head in bed. I would just feel like I was rolling down a hill, and just like we just couldn't figure it out. And at that point, my doctors just like they had said it was anxiety. I didn't want to go to school. It was maybe an eating disorder, hypervigilance is what they, instead of hypochondriac, they say like hypervigilant.
Wow.
And so we didn't expect anything to ever really show up on testing.
Mhm.
To have something show up was actually really shocking. So, like, when the inner ear stuff showed up, you're like, okay, maybe this
Yeah.
is what's going on. And that was really like it was a whirlwind after that. Because they had to take off my braces. I had to use brain MRIs because
Mhm.
they were starting to think that I probably had a brain tumor.
Wow.
And so I went from it's nothing to, oh my gosh, like pull out all the stops.
Yeah.
You probably have a brain tumor and let's figure this out. Um, but they found Chiari.
Mhm.
Uh, so that was my introduction to having a diagnosis. And I thought, hey, I looked it up. Maybe this could be my answer. And like this could explain all of the things that I've been dealing with for, the last however many years. But that just sent us down a whole other hill. Um,
Maybe I want to kind of like stop right here because I hear something that is very interesting. So how was your family support, like
yeah.
especially with the diagnosis, or let's say down the road of like so many years of everything normal,
Mhm.
like go to the doctor's office being told like everything show up on tests is normal, but then you feel
Mhm.
terrible. You do your family, they live with you, they probably
Mhm.
know that it feel horrible. How did they
Okay. Well,
yeah, I mean, I don't know if how did they cope, but more like how do they support you, or do they really believe, or especially when anxiety, hypervigilant, those things that comes.
yeah. So, well, I am very thankful that my family was always really supportive of me. Um, it was definitely like there were times where there was a little back and forth because you could see that, I'm from an anxious family. um, well, more so, my dad and my sister. Um, very anxiety prone, and a lot of people in my family deal with anxiety. And so I think that there was some back and forth
Mhm.
um, in their thinking that, they wanted, I think they wanted it to not be serious.
Mm,
So there's always kind of, I think that wanting to believe the doctors and wanting to believe that it's just anxiety.
yeah.
Um, but knowing that something was going on. And, my mom was always so steadfast when the doctors would say, well, she doesn't get sick any more than any other kids. My mom was like, I could not disagree more. I remember she said that to me. She was like, we know other kids. Like,
Yeah.
she's sick, like, she's vomiting every morning, and, like, she, can really only eat a couple foods, and she can barely get out of bed, and, like, her joints hurt, and her skin hurts, and every time she gets sick, it takes so long to get better, and then, it turns into pneumonia, and,
Yeah.
she got chicken pox, like, twice, and it was just like, she's
Wow.
like, she's not sick. Ew.
Um,
So, I always felt like she was very much on my side. The struggle came in when the school started
mm,
to ask questions because we didn't have answers, and the school, they were starting to threaten to take us to court, um, because I was missing so much school.
yeah.
And, you know, I was already so beside myself, just not feeling well. And now, like, my school wants to take me to court and in elementary school.
Yeah.
um, And I was always a straight A student. So it was like, when I was well, I loved to go to school. I performed well. I didn't have, social problems or anything like that. So my mom was always, she's like, I know my child.
Mhm.
I know when she feels well, and I know when she's not well. And so they really fought for me and brought me to specialists, and um that I think my dad wrestled with a little bit more. He didn't go to all the appointments.
Yep.
Uh, so maybe he's never been as aware as my mom has. And my sister she had so much anxiety around it, so it was very stressful. Um,
But
but
you're
you know,
like, did your sister has a lot of symptoms?
yeah. So my sister also has EDS,
Mm.
but it's much more minor so far, and we're hoping it'll stay that way.
Mm.
Um, she's she's always dealt though with a lot of anxiety and a lot of health anxiety. And so things were very tense between us growing up. Um,
Yeah.
just, her dealing with me being sick, and,
Yeah.
you know, my mom
Maybe.
had to give me a lot of attention.
Mm. Yeah, that's always hard to deal with, like, the siblings
It's a hard
relationship.
dynamic. I mean, siblings
Yeah.
are hard enough. So,
I would not know because I don't I'm a single child,
yeah,
so yeah. Um, but I would love to have a sister. For whatever reason, like even, like I think about she has a lot of anxiety, but you guys all, love her the same way because family, right?
yeah.
Yeah,
It's a special relationship. It's taken a lot of work over the years, but yeah, it
for
is special.
sure. Yeah, I know in fact like so much going through like your family, there's also always members that could not cope as well as, some do.
Mhm.
Um yeah, my mom is always like so anxious and he'll worry about me. My dad's more chill, just now he gets tired, so he doesn't want to. That always manages to go bad.
I My dad's the same way. He's like very, we're both very scheduled people, so it's like we take our night meds at the same time, and it's like we're like very different. We're like, okay, I'm going to bed now.
Well, that's good. Like, at least like when they say that you have mental health issues or something like that, like how did you feel about it? Did you ever doubt?
That was hard. I'm one of those. I was like, well performing in school, and I tried very hard. I wanted to do well. I wanted to be perfect as much as um, and it was very frustrating for me going in and having the doctor continuously saying that it was anxiety and that I was doing this to myself. And it was, yeah, I mean, when you're a kid and you have an adult saying something like that to you, like you do kind of question, well, there's nothing on the blood work, there's nothing on the imaging. Like maybe this is like what other people are dealing with, and I'm just not doing a good enough job. You know,
Mm. Yeah.
I am I'm somehow maybe I'm not sick more than other people. I'm just not putting up with it the same way. Pushing through, heading to school. And it did make me kind of question myself. I really fought for a long time. And then it got to a point where my pediatrician was like, I don't know if I can treat you anymore unless you try something for the anxiety.
Wow.
And so they put me on anxiety medication at age, I think, 11 or 12. And my dad was on that one, my sister was on that one. They both needed it, but
Mm.
I could see the difference. I grew up in a household with anxiety, and I didn't feel like that fit me. And I just like fought it for so long, and I ended up having to take the medication.
Mm.
And when I went to the doctor to speak to them, I was like, it's not doing anything. I don't feel any different, I don't feel any better. And so they said, well, it must just not be enough. And so they upped it, and they upped it again. And I don't know how much I was on by the time I was finally diagnosed, but I can say that when I was finally given the correct diagnosis, I asked to be taken off, and they took me off so quickly that I ended up in the emergency room with
Wow.
my first real panic attack.
And then you're like, well, that is not.
Now I know what anxiety feels like.
Yeah. Like a lot of people don't really realize like what exactly the mental health feeling is, right? Just like a lot of people don't know a migraine feel like if they don't have a migraine.
Yeah.
It's exactly the same thing. Things are vague, and so until they experience it,
Yeah. Yep. The medications, I mean, those things are anxiety medications are not something to be messed around with. And I
yeah,
really don't think that it should be pushed on children. Um, I definitely dealt with a lot of issues with panic coming off of those medications. It really changed the, the whatever they call it, like the brain chemistry for me.
yeah,
That's why I ended up with a panic attack, and I was, shaking. I mean, I thought I was dying, and it was just withdrawals from this medication that I never needed,
yeah,
and that never did anything. So that was incredibly eye-opening, and I just don't think that pharmaceuticals should be a first line in anxiety, especially
yeah.
for children.
I like the self-awareness of it. Like, you said, I just don't feel like it's the same as like, your sisters or your dad's, like,
Right, and I understand that we're human, and we all experience this wide range of emotions. We all feel anxiety, we all feel depression, but it wasn't an anxiety disorder, and that's when you treat it. It's just part of the human experience,
yeah.
and I just don't believe in that.
That's good. And like I like the awareness of how, like because a lot of people being gaslighted and then really think about that they do. And so like fitting like me, I fit in the box of like, having a bipolar, and then so you looking at your mood up and down, but you
Mhm.
didn't realize the normal human being has emotion of up and down too.
Yeah, it's especially difficult for me now coming out of it because now I have PTSD.
Yeah.
And I'm experiencing flashbacks and panic attacks and a lot of anxiety. And I felt a lot of shame
Mm.
and also kind of the feeling of needing to hide that because I had thought because of my childhood that I couldn't have both, that I couldn't be physically sick and also have emotional and mental health problems,
Yeah.
that had to be one or the other. And so now it's just been a kind of really difficult process for me to get through therapy and um, just be honest about how I'm feeling because I'm afraid that if I say that I'm anxious, that I'm just going to get thrown into the, bin of,
Yeah.
the anxious young woman. And now all my physical symptoms are going to be anxiety.
Hmm. Yeah, that makes sense. I mean, it's difficult to me to like I have to get to the calm state. Like I'm always calm. So then, like I'm getting to the doctor's office. I'm like, oh no, see, I'm not having any kind of emotional like, mental disorder or factors that are causing the physical issues. So that's why I was wondering, did you ever get diagnosed with something that it's like, oh, it must be your mental affecting your physical?
Yeah, I mean, let me see. So I had surgery for the Chiari
Yeah.
in 2012, and we really thought that that would probably be it. Like we thought that this was the answer. I was set up with a neurosurgeon very quickly, and I actually had a different experience that a lot of EDS people have, where my Chiari was very visible on a regular MRI.
Mm-hmm.
So
Well,
I guess I got lucky
yeah.
that it was severe enough, and the surgeon really wanted to move quickly. Everyone said he was the best in the business. I live in Boston, pretty good healthcare usually. So I was really fast tracked into surgery, and it was great for 6 weeks, and then things got bad. And that's where my journey with cranial cervical instability and atlantoaxial instability
They didn't
really.
find that issue before the Chiari?
So I did not know I had EDS. I did not know I had instability. Even though at that point I was walking with crutches because I couldn't put any weight on my right leg. I had such bad back pain and hip pain.
Mm.
And they zeroed in on they zeroed in on my lower back.
Yeah.
And I apparently, I had some discs that were out, and they didn't think that was unusual for a 16-year-old.
Like not 61, but 16.
They never put it.
Yeah.
So I came into the neurosurgeon with, for Chiari, I had a knee brace on, I had a back brace, I had crutches, I had an ankle brace, and didn't say anything, didn't think about anything.
Yeah.
um, I had Chiari surgery, and so many of the symptoms got better, and you know, uh,
It's validating that you did. Yeah.
yay! It's wonderful. We were rejoicing this was the answer. And then 6 weeks later, I was in the emergency room. It started small, it started with just like some twitching in my fingers.
Oh.
And I was at a movie. And I just like was sitting in the movie, and I was like, "But why is
Yeah,
it like
yeah.
it was starting to twitch?" And then like my foot started to go. And I was like, that's interesting. I guess I'm really overstimulated.
Yeah.
Like,
I feel the same thing, like with the twitch.
yeah. And so I think we're seeing the Avengers. So I was like, I'm just like overwhelmed. um, but it started to get worse, and it started to become more continuous. And I would just sit there, and whenever I was just passive, my foot would just be going.
Shaking.
It just got bigger and bigger with the motions. So 6 weeks after my surgery, I ended up back in the ER with just kind of full body convulsions, just very cyclical.
Yeah.
And, we went through all the seizure testing and all the EEGs, and it's, it wasn't coming from my brain.
Yeah.
So it had to be, well, it wasn't coming from my brain, so it must be coming from my brain, it must be. And I just remember they said, well, you just need to get some exercise because it'll help the neurons to fire again. And I was like,
the neurons to fire. I thought to fire too much.
Agree. And now you're telling me that like I have to retrain my neurons and exercise. Okay. They kept imaging it and saying, the problem is fixed. The surgery was successful. Your EEG is clean, and that's that. And like it was really scary. Because really after that, all hell broke loose. The I don't we call them now, we know it's dystonia.
Yeah.
Then we were just calling myoclonic jerks.
Did you have a lot of medications for it, or just
Yeah, so that is when I started to have some pushback from doctors. But uh let's see. Is somewhat just happened since then that it's like okay. So I so 6 weeks in is when the myoclonus started. And then probably a few months later is when all of a sudden I had an episode of one-sided paralysis.
Yeah.
And, I knew enough that we should probably have that seen.
Yeah.
Came into the ER, I couldn't walk. I had total facial drooping on one side when I smiled. It was not symmetrical. I was slurring my speech. I had confusion. I was not in my right mind at all. And that is probably the first time that I had a TIA, that I had a small stroke.
Did it
And
detect it?
I was not even given imaging. Um, I
So
was
like,
told,
yeah, oh, sorry.
no,
So,
go ahead.
okay. So I was wondering if you have TIA and they didn't do imaging, was it because the symptom, that it's really similar to it, and then
Yes.
you're certain it?
That was, much further down the line is when I started to have them more regularly, and, we found that I had venous stenosis in my brain and in the veins, like my jugular veins. So a lot of my veins have collapsed. So I have had now what we understand to be TIAs. But then we knew nothing. I still didn't have an EDS diagnosis. I didn't know anything. All I knew was that I had Chiari. I had surgery for the Chiari. I was doing well, and then all of a sudden I wasn't doing well. But my imaging was clear and I was all good to go. They told me they had someone in last week who had this surgery and he went skiing like
Wow.
like a month after his surgery and he's doing great. So I should try to get moving and get exercising, and that I should stop focusing so much on my symptoms. But at the same time, they sent me to a neurologist who put me on anti-seizure medications. And he just kept, it was the same thing that I saw with the anxiety. I would say, this is doing nothing. And they just kept upping it and upping it and upping it till the point where I was on the max dose of something called Keppra.
Oh, I
And
was on that too.
yep, and
Nice.
I didn't even know how strong of a medication this was and what I was doing. I mean, I had never even taken Tylenol before any of this stuff had started. And now I was on all of these medications. They weren't doing anything. And they were telling me I didn't have anything wrong with me, but still they were medicating me. Um, but that was the first time, like, that I saw a doctor go from, believing me and really, like, trying to help me to just being like, "Well, the tests are fine and the meds aren't working, so this must be mental." And they sent my mom out of the room and they asked me all these, like, do you like have eating disorders, or do you like ever want to injure yourself, or all of this stuff. And it was really scary all of a sudden
Mm.
to feel like, my support was whisked away, and then they were bombarding me with all these questions, and I was just like, I don't know, I'm just not feeling well.
Yeah.
And I started losing the ability to like hold foods down and swallow, and just having a lot of different things come up and a lot of negative answers. Um, and that was when I kind of took over trying to figure out what was going on. And I actually, believe it or not, found out about Ehlers-Danlos Syndrome on an episode of Diagnosis
Ah,
on TV.
yeah.
So
It's
it was it's like just one of those freak things. And I just remember watching it and being like, that sounds really familiar. And at the end, they're like, she has Chiari malformation. And I was like, oh my gosh, no way. Like, I just had surgery for that. And they're like, but wait, there's more. She also had Ehlers-Danlos syndrome and spinal instability. And that was when my brain was like, oh.
oh,
So I looked it up, and I remember like my mom woke up the next morning and I handed her a binder and I was like, this is what I have. These are the doctors I need to see. And long story short, we went to a geneticist and I was right.
yeah.
And that started us down the path of figuring out what was going on and finding out that I was unstable. Just not in the ways that my other doctors thought I was.
Yeah, I like the part that you said, I just hand my mom the binder. Like, yeah, I find the answer. Yeah,
I gotta
because
find that binder.
I have a lot of binders, but now I cannot use it. But it's funny, like, we seem to know our symptoms so well and it ends up to be right, but the doctors seem to be like on the other side, especially the one that supports you and didn't know what to do. It suddenly become like, now we have something to blame. Like,
I know. It's like, hey, but when I showed it to my pediatrician, I figured she would, care. And she was like, how was I ever supposed to figure that out? And I looked at her and I was like, I don't know, but I'm 16 and I figured it out. So
yeah.
And she also, she was really dismissive. She said, oh, that's the circus person disease. You don't have that. And I was like, excuse me?
Uh-huh.
Like, watch me. Like, and then I went and I got a diagnosis, and that was the last time I saw her. I was so done. By
Yeah.
then, my whole childhood, she had just told me, it's all in your head, and it's anxiety, and it's this, it's that. You don't have this, you don't have that. And like, yeah, well,
Well, she didn't really want even to learn or at
no,
least to
not at
know.
all.
No.
No, she was completely dismissive, and then really just, I don't know how many other patients she could have missed.
Yeah.
And that's the scary thing,
Yeah, because it's more common than we know.
right?
Yeah.
I actually have met more people who actually had her as a pediatrician as well, and she missed it in their case as well. So,
I mean, you can start with mild, right? Because it's not just like day one, it's bombarding amount of symptoms, but it's just
yeah,
collective and then gradually getting worse and worse.
all those little things over the years that seem unrelated, and all the different specialists she was having to write, but for me to see, and I can't. You can't blame them for not knowing.
Yeah.
But sometimes it's hard to mesh that with their response once you do know. When you do get those answers and you go back to them, there's some doctors who will be interested and want to like learn more, and who are apologetic that they missed this for so long. And then there's the ones that have the egos, and it's just like, well, you get that
Yeah.
like
Oh my
they don't
God.
have to be confronted. So
Yeah, I mean, especially they feel like they spend so many years in medical school and then suddenly like a kid telling me like they know more.
yeah, exactly. Yeah, I can imagine how that would feel, just to have a kid. I'd be like, well, I figured it out. But
Yeah.
I mean, I did.
I feel like as a physician, somehow they hold whatever they respond to the patients because that's their reaction really changes like how patients view themselves, view things. That yeah.
I think her voice will always be in my head. And that's the hard thing is that, like, a lot of times my mom is like, she's talking to me and she's trying to get to the bottom of what I'm feeling. And I don't really know how. I was never really given the tools to explain how I felt, but all I have is that voice in my head that's saying, you're not sick any more than regular people, and you need to try harder to go to school, and maybe this is anxiety. And there's always that voice that makes me feel so guilty. And I don't like, it's so sad that whenever I talk to people with chronic illnesses, it's like this immense guilt that we're not fulfilling these things, like going to school, getting a job, work.
Yeah.
It's like we feel like we can't participate in life because we haven't earned it. And I just always have, well, you don't deserve to go out and have fun because you haven't earned it, because you're missing out on other things. I don't know how to really
Yeah.
put words to that. But I think that, having a doctor who didn't believe me from a very young age really did a lot to, solidify how I think about myself and how I think about my illness.
Yeah.
Um,
I mean,
but
it's essentially someone that having a little bit of more authority than you, that
Mhm.
has more impact to
Yeah.
how you think.
Right.
Just like teacher, sometimes when teacher responded to the kids.
Yeah, I unfortunately really negative experiences with teachers as well. I didn't have answers to give as to why I wasn't in school, and it was really taken out on me. Um, but yeah, I look back and I just wish, like, all of these people didn't have all these egos. Just like I think about that year between being like the year between having Chiari surgery and being diagnosed with Ehlers-Danlos and undergoing surgery for my instability. I just wonder what I could have prevented had I had doctors who were fighting for me in that time. I have a good amount of injury uh, because I had, you know, I'm trying to figure out how to like phrase this in like a way that you can use.
Well, no, I can use anything. So I told people, like, this from a sort of like, oh yeah, we need to be sort of like be careful, not really like offend anyone, to like
Yeah.
it can be explicit, like in a way, but
Yeah.
just don't mention a doctor's name, anything like that.
Yeah.
But you can say anything the way
I'm
that
just
you want to.
I'm just figure out how to phrase it because I think that this is the most important takeaway.
Mhm.
Um, is that, I suffered, and I know that you understand this. Like, I suffered injury to my brain and spinal cord
Yeah.
within the year that I waited.
Mhm.
And I just wonder what my life would look like right now if I had known that I had Ehlers-Danlos from the beginning. And I just wonder if I had doctors on my side and if I had the full picture,
Mhm.
if I would have ended up with a fully fused spine. Like, that is not something that I recommend to anyone. I mean, it's not an outcome that is desirable. And I just wonder if it could have been prevented, if everybody could have just listened and put their egos aside.
Yeah.
Um, and it's really such a shame. It really is.
Yeah, I'm just thinking, yes, this is a really important takeaway. And I also think that when you say that, putting their egos away for once, and
Mhm.
it feels like, to letting them know that it really doesn't really hurt for them to take their ego just on the side once, and that amount of feeling uncomfortable, it's actually saving people's life. And not only just saving people's life as like, in a literary term, but also like, saving people's life as the rest of their life that will be maybe with much better quality.
Right.
Yeah.
Makes a huge impact. um, and unfortunately, I was dealing with a lot of egos when I went back with an Ehlers-Danlos diagnosis to my surgeon. His demeanor just changed. He was a totally different person. He wouldn't look me in the eye. He was really just like typing on his computer, and he didn't even turn to really speak to me. And I was saying, I've done research about Ehlers-Danlos, and it turns out that like it's seen with Chiari a lot, and
Yeah.
knowing who he is, I know that he had to know that.
Mhm.
And, when I came in with all of these different braces, when I first saw him, something in his brain should have clicked.
Yeah.
And he should have said,
Yeah.
like, maybe this is a bigger condition. And before we do surgery, we should do some more investigation. 'Cause all I had was a brain MRI,
Mhm.
coming to him. That's all I had. And it was so different a year later when I went and saw a surgeon who was familiar with EDS. And it was all of a sudden I was getting flexion extension MRIs, having different parts of my back looked at. And even then, we didn't have a full picture before I went into surgery, because this was like the beginning of
Yeah.
all of this kind of stuff in the EDS world. It was believed, you have skull C2 fused, and then you have tethered cord, and then you're cured. That is like the
Yes.
protocol. And so when we did see that like 4, 5, and 6 were unstable just by
Yeah.
accident in my first imaging, and like we had that history of those discs in my back that I never really put together. Like, why didn't we think about that? But it was a different world back then. So I had a skull to C-tooth fused, which saved my life.
Mhm.
And the shape that I was in when I got to him was, y- I just wonder if it could have been prevented. Um, if we knew all of these things before I was,
So
up.
yeah, so the flexion extension showed a lot. Um, or is that like the the C1, C2, the rotational CT and stuff, the 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 the, the
Yeah.
angles that changed, and also with the 0 to 1, like I don't know how bad it was, the shape was the imaging at
Yeah, so
least.
my story there. So I had a very aggressive decompression for my Chiari.
Mm,
So this is why I say what I said before, that if we had had the full picture, I wonder what damage I would have been able to avoid. Um, I had a lot of C1 taken out,
mm,
and I had a lot of the back of my skull taken out, and I had a duroplasty and all this stuff. So
yeah.
when they were imaging me over and over with my new symptoms, and they were saying, "There's no Chiari, it's gone," they were not kidding. Like, there's so much room. Like, if you would, like, see the MRI, and it was just, like, so much skull and bone was taken out that my head had just completely slipped down.
But they said it's
And,
fine because it's supinal, I guess.
uh, well, on my flexion and extension, you could see that, like, there was nothing supporting my head but
Yeah.
brain on spinal cord.
Uh,
And to the point where my surgeon had to make a special plate because there was nothing to screw the plate
Yeah.
too.
Yeah.
They had taken everything. And so that's why I wonder if, we would never have been so aggressive in this decompression if we had known that I was already unstable. And then they just took out everything that was like supporting it at all. And of course, they cut through the muscles.
Yeah.
Muscles take a while to regenerate, I guess. So, my head was really just, there was nothing at that point. So that was a no-brainer, literally. That surgery, we very quickly did that.
Yeah.
But 2 weeks later, I completely lost the ability to walk. And it was like, oh, yeah, tethered cord.
Well, so like after you did the fusion?
So when they pulled my head up, I gained about 2 inches and it pulled on the cord. And so I was just about to go home and I was walking down the stairs. I remember it like it was yesterday. And it was like with each step I went down, it was like my leg was like less and less able to really support me. And I just sat at the bottom of the stairs and was like, I can't move my legs.
Yeah.
And, I lost continence and, all of those great things that you want to have below the waist. So off to the ER. Luckily, I was still near the surgeon. And the next day I had tethered cord surgery.
Wow.
And it turns out I had the spina bifida occult. So missing, yeah, you too. Yeah. We're just great at that, aren't we? We're so yeah, missing bone, had to put plates and some screws in, and
Oh, they do?
I was like missing like a whole vertebra. And I'm like, how did we not notice this before?
Yeah, yours are occulta, right?
Yeah. So it was still closed, so we didn't see
Mm.
the outside, but
Yeah, mine is also occulta, but I don't know, like I heard expert was, talking about how the occulta makes a much likelihood for having the abnormal filing, basically.
yeah. Yeah. So, I mean, I always say that like I guess I'm one of the lucky ones because my imaging it did show tethered cord once we checked. And
I guess because when
yeah, it was
did
really
that, yeah.
it looked a little weird in there without that vertebra.
Mm,
So you could see it better.
yeah.
I consider myself lucky that my Chiari, my tethered cord, were never questioned.
Yep.
Because I know that's a huge problem in our community.
Yeah.
But
I still not consider having a tethered cord release surgery. I'm just having a back surgery, no date.
well, I can say that it was like night and day after that surgery. It was like I woke up and I was like, oh my gosh, I can stretch out my legs. Like it's been
Yeah.
so long. When was the last time I could do that? Like I did have neurogenic bladder ahead of time. We did test for that.
Yeah.
So it was on our radar, but we definitely didn't expect to have the surgery so quick.
Mm. And then did any bladder and bowel function coming back?
Completely. I gained everything completely.
So,
And I
yeah.
think it was probably like I'm thankful that I didn't have years of um just having like severe tethered cord. My cord was always tethered, but it was really only the 2 week that I had the extreme pressure like
Yeah.
pulling from the the fusion. So I didn't have like years of terrible bowel bladder, paralysis, because I know that some people have to like fundraise or find doctors, and like
Uh-huh.
that time the
Yeah.
damage is done.
I mean, yeah, for me too. I honestly was very thankful the surgeon is in the network. So like, it's easier for me.
Yeah.
But the harder part is like really getting everything ruled out before you have surgery.
Yeah.
I had my tether cord first. That's why I lost everything from waist down, except just some feelings. Um, and then that's when the things got worse. Like we kind of like we switched, right? Like I'm the
Yeah.
opposite.
Yeah. And I've seen them go back and forth so many times, and I know different doctors have different opinions on that.
Yeah.
I don't know what your opinion is, if you were glad that you went tethered cord first, or if you wished that you had,
I think it's
but
not, yeah.
I don't know if there's an answer.
I think there's a issue with like even patients has the experience, and then that gives you a little bit of a thought into
Mhm.
like whether or not you do technical first,
Yeah.
because like surgeons they will be like, I really don't know, like
Yeah.
then it's up to you, and then you look at all these patients that like, oh no, you really have to detether first, like
Mhm.
with all the support group, like with all the questions you ask, and you're like, yeah, so it's like a vote, right? Everyone's
Yeah.
like, okay, there are 60% of people saying Tadoko first, and then I'll just do that first. Kind of take a little shot, because I unfortunately didn't really see a surgeon, wasn't able to see a surgeon about my cervical instability issues, and I was not really believed with cervical instability. Yeah.
Oh, it's hard, and I don't know if there is a right answer. I've had my cord detethered 3 times now, and um the second time it was like I had thoracic instability very severely, and like my surgeon was like, we have to detether you before we can fuse the thoracic, and that I think was the right call. But I definitely remember in the moment being like, I am much more disabled by the thoracic, because that was, that really affected my breathing, and that really caused severe dystonia. So I was like,
Um,
just detether me, just do it. And
yeah.
so I just detethered. And then like a month later, I had my thoracic fuse.
That's
Um,
interesting. That's interesting. I thought like, because see how why did the thoracic well, why did the thoracic had to fuse, and then they said, oh, there's detether. Like I didn't really get that part, sorry.
no, it's fine. It was just I reached the point later on where um like I feel like because I kind of came at the beginning of some of the understanding of spinal instability with EDS, there was a lot of things that we didn't really have anyone to look at to say, "Oh, this is what we can expect."
Yeah.
It was I don't wanna say I was a guinea pig because I hate saying that, but it was all experimental at that point, and so, I had retethered, and I had also had pretty severe thoracic instability, and so we were going back and forth, like, which one do we take on first? Because we know we have to do both.
Yeah.
And, because they were obviously gonna be putting in rods and bone, they were like, "We have to detether you first."
Yeah.
Um, but in my head, I was like, I just wanna be able to breathe.
Yeah.
Like, I could care less about walking right now, I just wanna breathe.
Yes.
And like, I mean, I think that you probably know those like the rigors and the dystonia and just the seizing is just exhausting
Yes.
completely, like mentally and physically. And so I was at a point then where it was I was like, I don't care about the tethering.
Did you get
Um,
any medication that really helped the dystonia?
I was put on a few different things that I'm still on. I was put on something called Artane, which it's like trihexyphenidyl, and I think it's a Parkinson's medication.
Yeah.
And that helps. I still take it. And then also I take baclofen and Valium around the clock. So I although I am fully fused and I live a pretty normal life right now with my spine, I'm still on a lot of medications
Yeah.
that help me to stay this way. Um, and I have a lot of damage. It's like the years of being unstable and then all of the surgeries to fuse me and then to fix things that went wrong and all these revisits, and
Yeah.
it's done a lot of damage to the nerves and my functioning. So I'm so thankful for where I am today. Like I could not even have ever predicted life like this. I didn't know if I was gonna live, never mind walk again. And now, I'm walking for like an hour and a half on the treadmill every day and able to do like balance ball exercises. And so I guess that my main takeaway is just like don't give up hope.
Yeah.
um
I mean,
just
I don't know, like, do you I think the part that really gets to having the function, sometimes I think it's the timing, honestly. And I feel like some of you guys like around the area that it's like having the treatment, having the surgeon, that's like very important, the most important thing that
yeah.
yeah. So like he believes you, right? And like then they say detether again. Otherwise you couldn't find one and then there will be years of wait.
Yeah, and I really struggle with this as an advocate, because I have put myself out there and I have shared my story. And because of that, I talk to probably dozens of new people every week
Yeah.
who are just reaching out saying, I found your videos, I've seen your story, I, have followed you, I feel like I know you. And they're looking to me for advice. And there's, who did you see? Like, where do I go? How do you get this imaging? And
Yeah.
it's hard for me because I don't always have an answer.
Mhm.
And I definitely don't have, there's no one size fits all. And it's really, it's a lot. It is because
Yeah.
a lot of the doctors who were on the scene when I started out
Yeah.
aren't on the scene any longer. Or they have different approaches now. And, a lot of people live out of country and they can't afford, even people in country can't afford
That's right.
the care that I've gotten. And that's something that I have to wrestle with a lot because, I feel incredibly fortunate and lucky. That like I only had to drive 10 hours, 12 hours, 16 hours, depending on the doctor.
Yeah.
Mhm.
I mean,
But just
I mean, it is like, I mean, I think this is a problem. Like, why I even start this is raw stories, right? And everyone's story is different. Um, you can feel like you are lucky that you're around these surgeons. Some are not. but you're just one of the stories that, like, to be slightly different than others, and there's nothing wrong. You don't need to feel like guilty or anything like that. Yeah. And I think this is a great way to also show people that, the importance to have more knowledgeable surgeons, and that these kind of like knowledge needs to be shared around and
Yeah.
needs to be accepted.
Mhm. Right. I mean, at this point, like, I have a great surgeon right here in Boston. I live in Boston, and it is so nice. Like, I've never had this experience of, like, if I'm having an issue, it's like, can you come in tomorrow? It's like,
Mm.
yeah. It's so new to me. Wow.
Okay, next stop, I need to relocate to Boston.
Well, no, I mean, I don't. I wouldn't recommend it, to be honest. I am still doing a lot of traveling. Um, and the problem is that I am now in a new place. So I am now in a place where if something goes wrong and I need surgery,
Mhm.
um, it's much more understood because my surgeon now
Mhm.
is not an EDS surgeon. He's an orthopedic. He is I'm now working with specialists in failed fusions. Okay, so when people ask me now, like, who I recommend, I have a difficult time answering just because I've had so many experiences with so many of the different surgeons. Um, it's gotten harder for me, to be honest, to be able to say this would be a good fit for what you're dealing with, or this person would be a good fit. Right now, because I have been through so much, I'm I'm seeing orthopedic specialists now. Like if something goes wrong, I'm past the instability phase.
Yeah.
And now I'm just at like if something goes wrong, they have to fix like that part of my fusion or like put a new bolt in or whatever. Um, but people who are new on the scene, I'm feeling so bad for because I just, there's so many different opinions and so many different things. And it's just people are really struggling to get a diagnosis right now because the wait lists are just crazy.
Yeah. Yeah.
And all of this, there's all these opinions and I'm I'm, like, at a loss sometimes. Even within my own family, people are struggling with what I think are, pretty much instability symptoms, but it's hard to recommend to somebody to travel, and it's hard to tell somebody to put all of their eggs into one basket and
Yeah.
to put all of their money and their hope and their time into seeing a surgeon who won't necessarily recognize instability. And I was hoping that by now this wouldn't be a problem.
Oh.
Like it felt like when I started out that things were really looking up and there was like a lot of hope and we felt like we had the answers and we knew what to do. And now it's just kind of the waters are getting muddied a little bit.
Yeah.
And I feel bad for people who are starting out their journey now, to be perfectly honest. Um,
It is really difficult. I feel like to choose with
right.
surgeon and also recommend. Like I hear I actually got reached to by a lot of weird uh interesting cases. Like they're not the one that's saying that don't go to the surgeon, but they are saying I heard a lot of horror stories, but so don't go to these surgeons. So I'm just like, well, that's their experience, you know what I mean?
Right.
Like, and especially I think to people who just start their journey, have no one to believe
Yeah.
their symptoms and then to be valid. I feel like I feel like it's not a criminal thing that you recommend a surgeon. Like, at least getting the symptom to be like validated.
Yeah, it's so amazing. I just remember like the first time that I left the office and I had like my neck brace in hand and it was like, oh my gosh, that was so much information.
Yeah.
But like just that feeling of being validated and like having someone say, I understand what you're going through and I know why you're going through it. And like I mean, because there's always that self-doubt in your head that's
Yeah.
like, well, that's, like I'm just making a big deal about it. Or, I think, especially with the tethered cord, like sometimes, and I know like you really, focus a lot on the occult aspects. And it's like, there's nothing harder than tethered cord. Like mine, you could see it on the imaging. And yet still, when I woke up, I was like, anyone who went by, I was like, was it tethered? Like, because you like convince yourself in your head that, like they're going to get in there and it's going to be all fine. And like, you just were being dramatic, you know?
Yeah.
Like, I was like, it was probably just in my head, like, maybe it wasn't tethered.
It's exactly what I said, like, to my husband. Like, he said,
Mm.
well, every surgery you're gonna, right before you go in, you're still gonna ask me, like, what if it's not?
Exactly.
Yeah. But like, yes, I am like more focusing on occult aspect is because not just like, imaging, right? But also tests and then, things that are saying that, well, you should be fine. What do you mean you should be fine? Like I'm not fine. Um
I cannot tell you how many tests I've had, like how much imaging I've had and working with the neuroradiologist just to show that I was unstable. Like to show that you're unstable in the thoracic area
mm,
is incredibly difficult, especially when you already have fusions
yeah.
and when you're having severe symptoms. A flexion extension MRI, I'm sure that you understand that is extremely difficult to go through when you're symptomatic. I have a vast history of passing out during them and then having to redo them
Oh,
because I moved.
yeah.
And also, when like I would have hardware break or something like that, we had to prove over and over that these things are happening. So we have so many weird positions of me twisting and like just being x-rayed, and it's torture. And if they could just believe
Yeah.
like your symptoms, but they have to catch it on imaging. And if I didn't have a team of doctors and the right surgeon, I probably would not be here today. Like they fought for me and you know,
Yeah.
thank God.
Thank God, like you you never really had someone say, well, it's just functional, and it's hard to prove.
Yeah, I think, that's why we become so attached to our surgeons is because like if you go anywhere else, they think you're crazy. Yeah, and like any like instability, what? Like they don't understand. And it was hard enough trying to um prove to the insurance companies all of this stuff what we were doing was valid. But I mean, it was hard enough for my doctor to believe it because he like, had not seen. Yeah, I couldn't walk, I couldn't swallow, I couldn't breathe, and like when we like held pressure on my back, it would stop. And so like they would brace me really tight, and I was able to function for a while, and then it would just stop working. But if we just held it really, really tight, then I would stop. And then they would let go. And then I couldn't breathe and my diaphragm would go again. And so it was like, try proving that to the insurance company. It's like patient's parents pushed on her back. And so that's why we think that we need to do surgery. You know how it is with EDS and all the comorbidities. You don't just have one thing happening at one time.
Yeah.
You have like 50 things happening and you don't know why. And they're all interfering. And, the mast cell is a huge piece that just really complicates everything.
Yeah.
But
I'm glad this time I had surgery. I didn't have mast cell complications. I have all the meds and stuff. Yeah, it's really difficult if you go through surgery and then you have to deal with mast cell on the
yeah.
same time, or GI symptoms, right?
Mhm. Yeah, I've had a very up and down experience with my GI.
Yeah.
I spent 4 years, about 4 years, only on a feeding tube. And then I was able to reincorporate food. And then about a month or two ago, I had to go back on the feeding tube. So it's like it's very up and down.
Yeah.
Um, but I'm just thankful. I think that's the nature of EDS, is that like as bad as it is and as bad as it can always get better. Um, and I hope to be living proof of that.
Yeah.
There was a lot of times that, it was touch and go for a while. And then we really just were able to find the next thing and the next thing and
Yeah.
take those little steps. And it just felt like it still feels so grueling to just do the next one little thing. But in the end, I think, it really shows, especially I think with physical therapy,
Mhm.
because it feels like the process feels so slow, but it's so important with EDS.
Yeah.
So, like, I would just encourage people not to be frustrated if, like, all you can do is, like, move your eyes. Because I did about a year of physical therapy where, like, most of my exercises were just eye movements, and that was, like, all I could handle.
Yeah.
And I would get extremely sick after, sometimes I would have a fever after, like, I would just, like my autonomic system had to be completely retrained,
Yeah.
and, that just comes with some of, I think, the nerve damage and dealing with, like, I don't think that people understand enough that we we are spinal cord injury survivors. We are brain injury survivors.
Yeah.
These things are not in a vacuum. Like, it affects our entire system, and like my pituitary gland is probably never going to work. And so my adrenals don't work. I take steroids for that. And because it was crushed under the pressure, and
Yeah.
so now I have a shunt and I have a stent, and like my brain suffered a lot of injury.
Yeah.
And, all of the crushing of spinal nerves caused a lot of spinal cord injury. And I don't think that we give ourselves enough credit.
Well, this is something that medical system don't look enough at, is chronic spinal cord injuries, or
Mhm.
especially brainstem issues,
Mhm.
because brainstem is something that we often, even my surgeon right now, like, I have a phone telling me, like, if I get more research paper about brainstem, like, send him, because he couldn't find any besides traumatic brain injury, which is
There's that.
insane. Yeah.
There is no.
So I really love one of the I believe it was this genetic student like from the MUSC, like
Mhm.
she posted recently, like, we have a lot of joint instabilities, we have subluxations, but don't forget the spine. That's exactly right. Like, we always forget about the most important thing, which is like the vital thing that supplies the nerves, like, the central nervous system that
Yep,
supplies
your whole.
everything else. Uh-huh.
Mhm. Everything is affected, and I cannot stress enough to people that, like, it's not just headaches. It's not just back pain. Like, that wasn't even on my radar, really. I mean, like, if you had me list all my symptoms, like, the pain was so far down. It was more like I can't see. My vision is completely affected. Like, I can't walk. I can't swallow. I can't hold food down.
Yes.
I can't use my hands. I'm losing feeling like I have pain here. Like, it just I don't know. I don't, like, know the right words. It's just it completely disables every part of your body and every function of every system because every nerve has to run through there before it gets to where it's going. And just, like, explaining to people are like, "Well, I thought you already had surgery for that." And it's like, "I had 1 vertebra fused." It's like, I have quite a few.
Or
And
yeah,
it's
or oh, sorry.
oh, no, 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 no. It's just
Or
it's
it,
I have so many words, and I don't know how to say them because I feel like it's important.
yes, it is. And I can't believe, like, when you say that, like, with about the spinal cord, and I just feel like even the radiologist would say, no, it's just within normal limits. Like, I would ask literally every single person that I interview. I said, did you ever hear within normal limits? And then how do you feel about that?
Every scan.
Yeah.
Yeah,
Or tests,
yeah,
blood tests, things that just
and
never
it's
really show exactly too
oh,
wrong, right?
and, I can't tell you how many times I have said, you know, I've had this test so many times, and even though it's considered within normal limits now, I think that we should explore why it's changed so much. Like,
Yeah.
if I had something that was, like, borderline low
Mhm.
a million times, and then all of a sudden now it's borderline high,
Mm.
who cares, like, what a normal limit is at that point? It's like, how did we get here?
Yeah.
And can that indicate something? And, like, sometimes that has led to, okay, more testing and then finally finding out what's going on. Um, but it's definitely a battle, and I think that EDS never falls within normal limits, and I think that we never have, like, we never really, like, uh, let's see, like, I think with, like, the intracranial hypertension,
Yeah.
every doctor that I've spoken to who sees more exclusively EDS patients has said directly, "Oh, yeah, no, we don't even consider normal limits when it comes to EDS because EDS patients tend to be much more comfortable at a lower pressure." So, like, what might be borderline for a regular person is often much too high for an Ehlers-Danlos patient. And that's the difference between seeing an Ehlers-Danlos specialist and just seeing a regular doctor.
Yeah.
I do feel like you have to be careful. You do have to vet your doctors. You do have to get second opinions because you don't want to fall into, just only trusting somebody because they are Ehlers-Danlos literate. But makes a heck of a difference.
Yeah.
It really does.
I feel like without seeing a EDS specialist, like often they would think, oh, either you think too much, right? Or,
Mhm.
well, it's just a headache or migraine. Why do you think about that? That's like something more severe or serious. Or, yeah, you had just some twitch, like abnormal movement. That's what my ER like notes said. And I was like, what does that mean?
You don't end up in the ER just because you're twitching. Nobody wants to be in the ER.
Yeah. And I mean, it's so funny how like somehow radiologist normal limits,
Mm,
the scan shows clear, like, because it's normal. Um,
right,
it's so much more important than our sign or symptoms.
right. I know. It's really scary. And, the thing that really gets me, and I think, we need more dynamic imaging because, like, I mean, the flexion and extension MRIs, like, that's a big step up. But we need to still do better. We need to have more fluoroscopies and dynamic X-rays, and a couple times we've had to like kind of come up with our own like positioning for the CTs because we wanted to catch what was happening
Yeah.
when I was doing certain motions, because EDS and a lot of other conditions, like, it doesn't just present when you're lying still. Like, your symptoms are dynamic.
Yeah.
And so if you say, well, when I'm standing up, I'm having this problem, what is it going to do to have you lie down and stay still?
Yeah.
It, I mean,
Yeah.
it seems like common sense.
I mean, it's completely feel like common sense to us. But somehow my doctor hasn't really accepted like, flexion extension MRI. Just they're like, yeah, so what? Like, but even to a normal human being, like I don't think my dad has EDS, but even
Mhm.
him was suddenly saying, oh my God, I was sleeping like this way, and it's suddenly like this arm here has a little shooting pain. Like he has a little bit neck issue.
Mhm.
But like so yeah, so then I think it's really normal to imaging people in certain position that they have symptoms.
Yeah, it makes sense to me, but it's it's really unfortunate. And I think gravity just plays such a huge role in this condition as well. So,
Or
like, why are we still doing imaging lying down?
yeah,
It
I
baffles.
yeah, I know more research, like
Yeah.
more statistics like showing that this is really happening. Like,
Mhm.
with not EDS, maybe even normal populations that, the standard MRI should never be the end
Yeah.
of testing, right?
No. No, I always tell people, it rules. Maybe you can rule something out, but like doesn't rule everything in. Like, or maybe like the opposite. Like, you know, if it's positive,
Yeah.
then okay, great, you found it. But if it's negative, I don't know if I trust it still.
I feel
Like,
like mm, sometimes the upright MRI is still a little bit tricky, like with
oh
physicians.
yeah, it's yeah, it's torturous for the patient to go through because you're symptomatic
Yeah. But
and
prove
you have to stay
something.
still.
Yeah.
But yeah, it's hard, and it's hard to catch things. I know with my knee, I was having this issue for like 4 years before we caught what was happening. And it was because we thought the patella was just slipping and we couldn't catch it because every time I took a step, it's made a snapping noise and it hurt. And like it would get really swollen and like turn like black and blue, and it was really severe. And like with every step, it was like click, click, click. And just we're like, it must be the patella moving. So we kept pressing that and it didn't do anything. And finally we ultrasounded it while I was moving. And it turns out that it was actually the fibula was dislocating and then snapping back into place every time I took a step. And so it really, it did some good damage to the nerve in there that it was hitting every time, and it was actually cutting off the blood flow. So that's why it was so swollen, and they had to fuse the bones together and move the nerve and the whole vasculature out of the way. But it was like, it took us 4 years because every time they did an MRI or an X-ray, it was fine. And it was actually the ultrasound techs who were the heroes.
Oh,
They could actually see what was happening when it was moving.
yeah. That's awesome. I definitely hear some of the ultrasound things that it can show, like the blood flow, like jugular vein or something like that. Like
Yeah.
I think those are so good to like be able to prove, like, you have something actually on test that's abnormal.
Right. And it makes the biggest difference to have a team behind you who's saying, "We understand that something's happening, and like we are going to find out what it is, and we are going to throw everything at it that we can to figure out what that is." When you find that team, hold them tight and don't let them go, and text me who they are because I would love to see that. Like it's
Yeah,
so hard to find that in medicine.
it is really difficult. And I feel like sometimes like you have a you have an active advocate for yourself, right? But then you have a passive care team who's like lay back and like, oh, we don't know. Yeah.
Yeah. That's
Yeah.
hard. It's hard when you feel like you're just a number or like they really just don't care that much at the end of the day.
Yeah. Well, it's especially the symptoms and stuff. Like I can see how like this is a positive things that to feel like look up to, like feeling like maybe there's some hope, like as early as possible, because I know there's a lot of mild cases of CCI.
Mhm.
Or like, I think mild is still like it's damage to the brainstem and spinal cord. Some people still have issues with walking, but believing to have some kind of functional thing. And
Yeah.
you have kind of ticking bomb, like you're not really getting that taken care of. Doesn't matter if it's seeing a PT or doing fusion.
It's difficult. And I will be the first to say that like my opinion has changed over the years, as surgery, as you know, is not easy and it's not the cure. And like I think that people really think that like you can go and have surgery and then you're cured. And that it's hard to, I don't know. Uh it's hard to say, hmm, sorry. I really like, it's so hard to put into words how thankful I am, but at the same time, I think that like surgery is never anything to be rushed into. And surgery in Ehlers-Danlos is especially difficult. We like tend to respond really, really well to things or like really, really poorly to things. And it's hard because like it's hard to know which one of those camps that you're gonna fall into. But I I always have kind of a hard and fast rule that like if it's like Chiari and cranial cervical instability, like you don't mess with the brainstem.
Yeah.
To me, it's just like I would highly recommend surgery. But it has to be the right surgeon.
That's true.
And it's, I think it's worse to have surgery with the wrong surgeon than to not have it at all. But when you find the right team and like you really have like someone that you can put your faith into, it's amazing the things that can happen.
Yeah.
And like I will never stop fighting for more like early diagnosis and treatment for people with Chiari and cranial cervical instability, atlantoaxial instability,
Yeah.
tethered cord. I think those are I would not mess with those. Like all of the other fusions I've had, you can question things, it definitely was more of a pros and cons thing, but I mean, just don't mess with that brainstem because you can't always get it back, and it makes me so sad. I like look back and I'm like, my poor little like brain, like it was trying so hard. Um, and I think we also were really failing when it comes to aftercare. I think that patients need to understand that like it's not always going to all come back the second they wake up from surgery. And that's to be expected. Just to think like what your body has been going through, like it's almost amazing to think about those nerves that have been like compressed for so long to like finally be firing again, and like your body is relearning. I mean,
It's like
I just
crazy.
it
Yeah.
feels like a miracle. It really does. And I think that like there needs to be more understanding about like it's not over at surgery. Like it starts at surgery. And that's when the healing begins. And that's when the magic begins. And like you really need to put the time in with physical therapy. And I think that like one of the reasons that I was like so drawn to you and to your story is that like you don't define yourself by all of this, but you're also not letting it go. And I think that like your love and your passions for music is just so beautiful. And I know that that is going to get you so far and it's going to get you through this. But also, it's like a tangible thing you can use to show people, like, hey, I'm here. And despite all of this stuff that's happened to me, like I am healing and I'm doing this and I am not letting this define me and what I love. And I'm so freaking here for that. I just love that. Because it takes and it takes and it takes and it takes away from us. And you were like, no, I'm not giving up, my love of violence and my love of life and my love of my like trying on cute wigs and stuff like that. You're like, no, I'm not letting it take everything from me. And that's the magic, and that's what I feel like we have to be fighting for. And by putting yourself out there, I think it's just gonna do so much good.
Yeah.
I don't know. Like sometimes sometimes the words just come out of my mouth and I don't
No,
really
that's
know what I'm
great. No.
like.
Just let it go. Like, so sometimes, like you said, magic, happens. Like, I feel like sometimes magic happens with words, just like you don't really know where it's going, but then it's like it finds its way.
I know. I feel like I don't know. I've just been in such a place with my brain in the last week. That it's just, the words just kind of don't have a filter anymore. But like, you have to set goals, you have to have passion after, because like I've been in this game for a long time, and I've seen a lot of people enter this game, and your expectations have to be at a certain place when you take on surgery.
Yeah.
And I think we don't support patients well enough after surgery. I think that we create this idea, and especially, I mean, people have to fundraise and all of this stuff. So we create this idea that like this big build up to the surgery and like the big day. You know, you wait years for this. You find the doctor finally, oh my gosh, you know, I've got all these symptoms and it's going to be better afterwards. And people leave their home countries and they have like their whole town is waiting for them when they come home. And I've talked to so many people and they're like, I don't know how to go home and tell them that like I have to have another surgery because I have another area of instability, or like, you know, I'm still struggling with my swallowing since surgery. And it's hard for me to be honest about that part of my story because there's been this huge buildup and everyone's expecting me to come home and be cured. And we all hope for that. And I think that surgeons can sometimes feed into that.
Yeah.
And the aftercare is like what a lot of us really need and we don't get. And it's just like the PTSD from this experience, the actual brain and spinal trauma. Like I ended up in a rehab and I ended up on the brain injury floor. And I just remember being like, they must have just not had a bed anywhere else. Like they just, you know, and it took me years to understand that I had a brain injury. And like, you know, my physical therapist was like, you know, she was like, you are faking your way through more than you even know. She was like, you know, here's a clock. Like, tell me what time it is. I'm like, I can remember knowing how to read a clock, but I can't read it. Or like making change. Like she was like, if I gave you this many quarters and dollars, you know, and
Yeah.
whatever, like what would my change be? And I'm like, I have no
Ugh.
idea. I literally like I couldn't even like make the thought process. And it just, I don't think that people understand what healing really looks like
Yeah.
after this kind of surgery. And that there are setbacks, and the setbacks don't mean that someone has failed. It doesn't mean that we failed. It doesn't mean that the surgeon made a mistake or that they failed us in any way. It's just part of it.
I think that fed into the whole entire doctors who don't believe you, right? And then they might have the ideas of like, oh, we will see after surgery. So that means if it works, if you get better, if you don't. And often, like we said, I feel like this has to get into people's mind as like not just EDS, but normal human beings have ups and downs. You have days that you feel really crappy, and there's days you feel better. And that doesn't mean the fluctuation means that, oh, I have an anxiety or, you know, I have a functional FND or something like that. Right?
I have a huge problem with functional diagnoses. I really do. I have never come across one that was a truly, truly just functional. It's crazy to like take take someone's whole journey and to look at it and to see that they have valid medical diagnoses and then take one little part of it and be like, no, this part is in your head. It makes no sense. And it's like, I know that functional is not in your head in the way that like it means you're faking. Like I understand the implication is that, you know, your body is so overwhelmed that your brain creates symptoms, but it just doesn't gel with me. It just no sense. It just sounds like a really fancy way to write. We have no idea what's going on.
Yeah.
And it's the ego again. Instead of saying, I don't know, like doctors aren't allowed to say that. They have to send you home with something. So if they can't put a diagnosis next to it, then it's got to be functional.
Yeah. They have to have a CPT code, right?
Mm. Yes. Yeah. CPT. I don't know. It's really disappointing. And I have worked with functional doctors before, and I have had a lot of good things happen. You know, working with a functional doctor is a fantastic experience if you and the doctor both understand what's actually going on when you enter into it. The power of the mind is incredible. And like, please, 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 like, learn how to harness the power of the mind. It will only do you well with your physical health. But oh my goodness, like, do not give up on it. Like, if you know that something is happening that's physical, I don't give up. Honestly,
Yeah.
keep finding, like, keep doing your research, keep talking to people. I've seen some really amazing things come from people who just didn't give up. And I think you're a really great picture of that. Of someone who just didn't give up and you didn't accept, what you were being told. And I think that, like, the world's your oyster now.
It's hard to accept that someone just tell you like, hey, your pain is just like functional, your spasms and all that symptoms. And I was like, how
I
does
don't feel
that?
very functional.
Yeah, and then they said, well, the part of it is okay. So my take on
Yeah,
with your what you were saying is that I do believe the same thing, that I feel like sometimes people say, oh, there's always like origin, like, the actual pathological side of it. But then like you still can have two at the same time. And then like MS, like often with functional. So then because I went through Evoke Potential, and because I was being told that often that didn't show on imaging, there's too small to see. That's why when we do Evoke Potential, and I'm just like, all right, so I just don't get why people accept functional as the comorbidity of your other diagnosis of neurological disorder, because imaging is normal or imaging is clear on that part when you have symptom. Then I'm just like, why can it be too small that they didn't detect?
Yeah.
The technology isn't further enough that we're showing everything.
Right.
Like the 20 years now, like we're still doing MRI thinking that it will show everything, but it might not, like that's something to think about. But I do believe the mind is powerful. Like I actually just recently read an article about how the people who have spinal cord injury, and when they're firing their brain is much brighter. So like the cortical is much brighter. And the reason is because they try to get through the narrowing, the damage that it is, to have a little bit movement. So like your brain is like 10 times powerful than others.
Hey, maybe that's the problem. We're just too smart.
Yeah, we are like, it's the opposite of like being functional, which they said cortical doesn't really send enough signal.
Yeah.
Um,
I think so hypersensitive. Nerves and everything.
Yeah.
I-
Yeah, it's also very interesting that how the way that I did evoke potential, and then they said something about, oh, your cortical still lit up. That's a good thing.
Mhm.
But your subcortical doesn't really do like much, like doesn't show much. And now I think back, I'm like, yeah, because my brainstem damaged.
That would do it.
Yeah. Well, it's still resilient enough that send some signals to the brain. You
Mhm.
know, your body is trying so hard to giving signals and then trying to letting you
Amazing.
know. Yeah, it's resilient.
We really, I mean, like, I just people say to me, like, you know, when people say things to me about being disabled or like, just, you know, they kind of they say like, well, why don't you feel like why me?
Mm.
And I'm always like, well, why not me? Um, and like I don't feel like my body has failed me. Like, I feel like my body is fighting so hard for me. Like, I feel like some days I'm just so thankful to my body. Not for, like, the failings, but for the triumphs and for the things that's wow, like, I was dealing with all of that and, like, we still, like, made it through, you know?
Yeah.
Like, all of the things, like, just pushing through and you think what was happening inside of you when you were dealing with that, it's like, wow, the body is so like, the neuroplasticity and just the way that it, like, rewires everything. I mean, like, they moved that whole nerve in my leg, and it's been such a journey of, like, the nerve figuring out it's now in a new spot. Like
Yeah.
it's like you touched one part of my leg, and I'd feel it in the other side because
Mhm.
that's where the nerve used to be.
Yeah.
And, like, now, like, years down the line, I actually, like, grew back some of the bone they had to cut out, and, like, my nerves have completely rewired, and, it's amazing what our bodies can do,
Yeah.
and, like, learning to eat again after, 4 years. I mean, it's a process, but, like, being able to it it's amazing. The body's amazing,
Yeah.
and I think that we do need to harness the power of our brains to help us to heal, but I it's, it's used against us at this point. I think these functional disorders are
Yeah.
it doesn't make sense to me for somebody who has, like, real, like, chronic issues to also have a functional diagnosis in the way that, like, I know that a lot of EDS people were, like, diagnosed with fibromyalgia, and a lot of people with GI issues, it was just IBS. Like, these are just, like, diagnoses where it just gets thrown in.
Whatever
And, like,
it's not in the box.
some people have these things, but, like, I think that when you have a real diagnosis like this, like, to have something on the side like that, it doesn't make sense.
Yeah.
So I am fighting against, like,
Yes.
and also these diagnoses are being handed out by people who have just met you, like, in an ER setting,
Yeah.
who have, you know, somehow have the power to overrule a doctor who's been seeing a patient weekly for like 10 years.
Yeah.
And I just think that it's an abuse of power and it needs to stop.
That's right. I really do think so. Yeah. So like when you said something about the ER, I really that this is something I'm fighting for as well. And that this is one of the podcast reasons why we also started the whole project is to see if there's some changes that can be made that prevents like, the first line of diagnosis like this. And
I hope. I really hope.
yeah,
It's
yeah.
dangerous.
I mean, isn't that right? Like we could have have like, multiple differential diagnoses besides that, you haven't really ruled out of that much yet. You haven't even looked at the upright MRI, but they don't really think that as a consideration of what's right, what's going wrong, what's pathological. So
Yeah. And the second it's put out on the table, it just trumps everything else. And it really, I mean, it's like a big black bar on your medical file. And it's really ruining the care for so many people. It's completely an abuse of power. It really is. I think the ego, I mean, just the lack of even being able to request a second opinion. It just makes me crazy. And I've been, you know, I say this as someone who works with people as a medical advocate. And also, I work with end of life patients as well, which is something kind of new to me. And I'm kind of newly becoming certified to, walk along people at that end of life journey. And this is probably like off topic and I don't know, but it's just all week I have been on the phone with people fighting doctors who are just telling people that it's functional or I don't know. It's been a long week.
No, it's
girl.
okay. I just feel like this is really important to actually mentioning because I feel like
I kind of
they
have
always
like and think about how to put it.
yeah,
Put
but
it
they
into a usable sound bite at this point because I'm so overwhelmed by like it is the new thing.
I
And
mean, it's a new global issues. It's not just nationwide, and we kind of recognize that this issues really severe, and that many people being put into, like you said, the end of life, and they don't really get any treatment, any care, and just more medications. And you know how bad it is with brainstem and spinal cord, and it doesn't really come back that easy for years. And if it's injured repetitively for years, that delayed with treatment.
yeah. Yeah. I mean, I had a doctor who was so wise, and he said to me, it took 4 or 5 years for you to get here, and it's going to take 4 or 5 years for you to get out of this.
Mm.
Like he said, it's just we can't expect things to come back immediately, if at all. But he just said, you got to be patient. Took you 4 years to get here. It's going to take you at least 4 years to get out of here. And I just remember thinking, oh my gosh, I don't even know if I can live 4 more years like this. And you do. You just do day by day, and you find little ways. I mean, I can't. It's like looking back on my journey and just thinking like, oh my gosh, like the thought of using a walker or a wheelchair or a cane or a feeding tube or oxygen, like all of these different things that have been something that I've had to use seemed like such a huge deal, and it seemed like the end of the world. But then so fast, like you just get used to it.
Yeah.
It's just part of how you go through life, and you just gotta rock it.
Like you adapt to the new normal.
You embrace it. Yeah, because what might seem like a decline to some people is actually like a really big step up to a lot of us.
Like to me at this point, I don't even think about like any healing, anything, but I'm just like, yeah, I'm just gonna go through the day. But like that's okay as well. But the thing is that you don't want to give a hope and thinking that, oh yeah, it's just my brain broken. Like
Yeah.
Yeah, I think the amount of diagnosis with EDS and FND, it's just a little bit out of proportion and out of the norm to think about how these two are related.
Yeah. I mean, I can say that within my own family, we have struggled with FND diagnosis. My cousin, she is 2 years older than me, and she was given an FND diagnosis, even though her main diagnosis was Ehlers-Danlos and Sjogren's and mitochondrial involvement. And like she crashed completely about 2 years ago and is now in a power chair and almost, she can get back and forth to the bathroom and stuff like that. But like any kind of physical exertion, like she'll sleep for like a day or two and like completely collapse. And this was all of a sudden that this came on after many, many, many years of dealing with just like EDS and mito and Sjogren's. And so she had this horrible crash and she was in the hospital getting help. And then all of a sudden, like neuro came in and psych came in and slapped an FND diagnosis down. And since then, she just lives from a hospital bed in her power chair and just has carers. And she just feels like literally all of our doctors have given up on her.
So many people are told to only will get better if you truly believe it. But it feels like a cult. That's when people say you have to truly believe it to get better.
Yeah. And I mean, I've seen that. I mean, I grew up in like religion and stuff like that. And I've had people, say like, you're not praying hard enough if you're not healed. And it feels very much like that. And I've also seen like, there's like the whole other side. There's like the people who tell you like you're not taking enough turmeric or you're not meditating enough. And it's just like, you really can't do anything right without like people always having their opinions. But like now we've run into the medical version of that.
Yeah.
And you can't get past that. Like, if you have an FND label, all of a sudden you start to lose all of your care and all of your hope. And it makes no sense because she and I are very similar and we are related. And there's absolutely no way that it isn't genetic.
Yeah.
And because she had a history of some psychological things in her chart, she was viewed differently, even though I have the exact same patients, or I have the exact same doctors as my cousin. I had the exact same diagnoses as my cousin. And because she walked into an ER and somebody was on call that day who decided that this was functional, her medical care has been completely derailed to a point where I'm not sure if her body is ever going to be able to recuperate and to undo the damage that's been done. She just had tethered cord surgery, but she had a very difficult recovery because she's had many more years of damage and many more years of neglect. And that's what this is causing. That's what functional disorders, like doctors, they just don't think twice. They just send you home with something because they need to put a code next to something for the insurance. They don't think twice about it. But they are derailing the medical care of somebody who could possibly lose their life because something is being missed, something physical, something structural, something true and real is happening and it's being ignored because they're being told that this is psychological, and that is not okay. And I will fight against that until I can't fight anymore because it's not fair. And I think that they're profiling people. I think that they're racially profiling. I think that they're profiling people by how they look, what color their hair is, what color, their weight, their piercings. Like, I think that they see someone come in and they've already made up their mind.
Yeah.
And it's damaging.
Yeah.
So keep that in.
Yes. I'm just really, really glad that people are on our side and then noticing that and then recognizing this, how damaging this is, and this, how the system has become to the point that we cannot ignore anymore.
Right. It's so bad. It really is. And it's like, it's so hard to explain, like, no, my PTSD is not causing my physical symptoms. My PTSD is from the way that I've been treated because of these symptoms. Like, it's unbelievable. Like, I go into things and I'm not afraid about the procedure or the pain or the surgery. I'm afraid of the people.
Mhm.
And it shouldn't be like that. It's always like you just don't know who's going to be your nurse that day. You don't know who's going to be your doctor that day. And like the rest of your life could depend on that.
Yeah.
And that's terrifying. Those experiences for getting me this far. Even when I'm like, oh, maybe that surgery was not exactly what needed to happen, or, this needed to be done or that needed to be done. It's like, well, it got me to the next thing, like I owe my life to all of those things. And yeah, maybe it caused other problems, but I'm here today getting the right treatment because it bought me a few years. And sometimes it's just like it comes down to buying yourself a little bit more time.
Yeah.
And we have to be thankful for that part of the journey as well, even if it's hard.
Yes. I think that's great to end this episode. And also, I want to also say thank you to my surgeon, actually
Yeah.
my surgeons, although, we're not turned out that great sometimes, and it needs to happen for the next thing and
Right.
to get better. So yeah, thank you so much for joining us on today's episode. And a special thank you to our guest today, Christina, and we shared their really amazing stories with us.
Remember, whether you are a patient, caregiver, or healthcare professional, your voice and advocacy are crucial in improving the healthcare system and supporting those with hidden diagnoses. If you enjoyed this episode, please subscribe, rate, and leave a review. Your feedback helps us reach more listeners and continue to share these important stories. You can also follow us on social media for updates, resources, and more inspiring content at Hidden Diagnosis Impact. Until next time, keep advocating for yourself and others, and stay tuned as we continue to uncover and understand the reality of undiagnosed or underdiagnosed conditions. Thank you for listening.